like Whipple surgery and lung resections. His compassionate, patient-centric approach has made him a trusted name in oncology. And Dr. Prasad has also published 6 papers in national and international cancer journals. Over to you, Dr. Prasad. I mean, a lot of people are waiting for a lot of questions they have, right? The myths and everything. So yeah, we can start.
Well, thank you for the introduction. So every year, 4th of February, we celebrate it as a World Cancer Day. I'm audible? I'm audible to you.
Yeah.
Yes.
4th of February, we celebrate it as a World Cancer Day. So the reason being, it is just to create awareness among the people and to know what is the incidence and how the disease and how early we can detect it and what is the chances of cure and how do we bring down the incidence of cancer by giving her a few of the health tips or a lifestyle modification, what we call it. Just let me take you to my presentation. So this time the theme is United by Unique, which means so we are united in our goal, which is the cancer cure. The unique is each patient's needs are different. Even though there are 5 patients with the same cancer, their treatment is different or their needs are unique. So what we'll just run through a few of just like an introduction. What is cancer? It's just nothing but an abnormal and uncontrolled multiplication of cells, leading to formation of a tumor. We call it as a lump or a tumor. Suppose we leave it like that for years together, there is a chances that a tumor which will convert into a cancer. So probably it's something, some small lump or what we identify in our own body. So all cancers are tumors, but all tumors need not be cancer. So how do we differentiate whether it is cancer or it is just a tumor? It is only the biopsy it will tell us. The other thing characteristic of the tumor is, so usually the cancer cells, they spread from one region to the other region of the body. It may be some tissue or organ. Suppose somebody has a breast cancer or a liver cancer, or there is a tumor in the breast or a liver. How do we say it is cancer or not? Suppose there is already a spread from one side to the other side, what we call it as a metastasis. So then we call it that it is a more likely a cancer. So how many stages we do have in cancer? We say stage 1, 2, 3, and 4. So stage 1 is whenever the cancer is confined to that organ. In this case, I've just taken as a breast cancer as an example. So if the cancer is confined only to the breast and it is smaller in size, then we call it as a stage 1 cancer. Stage 2 is, suppose from the breast it has gone to the next station, we call it. Usually the cancer follows a pattern of spread. So from the breast lump, it has gone to the armpit, where we have the axillary lymph nodes we call it. So if it has spread from the axilla, from the breast to the axilla, we call it as a stage. Stage 3 is, suppose we have a bigger size tumor and we have multiple nodes in the axilla. So then we call it as a stage 3. It is a little advanced stage, what we call it. And see, the problem with India in cancer is the most of the cases what we are detecting is in the advanced stage. Probably it's the lack of awareness, or probably they are not aware that once there's something lump or something they identify, they have to consult a doctor. The stage 4 is where the disease has already spread to the other parts of the body.
Doctor, sorry to interrupt you, but the voice is like a little unclear. Your voice is a little unclear. It's something muffled. A lot of people are not able to hear you properly. Can we try without headphones maybe? Maybe that is why your voice is muffled. I'm not sure. I'm just suggesting.
Hello.
Yes, I think it's better.
Yeah.
I think it's better, yeah.
Yeah. So stage 4, we call it when the tumor has already spread to the other parts of the body. So probably in a patient with a breast cancer, the patient already has a breast cancer and there is a tumor in the which has spread to the brain also, anyone or even multiple organs also we call it as a stage 4 cancer. So why it matters actually? See, cancer has become a major health concern worldwide and being the second most common cause of death globally after the cardiovascular diseases. See, probably in another 10 years, it is going to be the number one cause of death globally. So the point is, see, almost like one third of the cancer related deaths can be avoided just by early detection, which is through screening and early treatment. So probably we are not aware or what not, we are not going giving importance to that. That is the problem. See, incidence in India, suppose we look at it, India has the third highest number of new cancer cases. So we actually the in 2022 we had 14 lakh new cancer cases detected. So it means like almost 1 in 9 people in India are likely to develop cancer in their lifetime. Suppose we look at the statistics also, even though these are just the projected scores, we see incidence of cancer, say from 2020 to 25, there has been 12% increase. So in another 10 years, it is projected that it is going to increase by other 40%. So if we come to Indian data saying that what are the most common cancers we see in males and females. So females, usually around 10 years back, it was the most common was the cervical cancer. See now the breast cancer has been overtaken. See most common is breast cancer. The second is the cervical cancer. And third is the ovarian cancer. When it comes to males, again it is again because of the rampant use of the tobacco, we see again head and neck cancers and the lung cancer, which is the most common, one and two. And third is the esophageal cancers and stomach cancer, what we see. See, the interesting thing is about the see number of cancer deaths. Even we say the incidence of breast cancer has increased, and we see more cancer cases in the younger female. Probably it's the lifestyle, all those things. See, we see around 26% is the incidence, we call it. See, mortality is the deaths due to the cancer. You see, almost 50% of the people who are diagnosed with cancer are dying. Suppose we say even the cervical cancer, 17% is the incidence. We see around 11% people are dying of cancer. Again, head and neck cancer, roughly around 10%. Again, mortality is 5%. Suppose we look at all these things. We say around, say, 100 people are diagnosed with breast cancer. We say 50 people are dying with breast cancer. What is the reason? The reason is the same. We are unable to pick up the cancer at the early stage, probably a stage 1 and 2, or people are coming for the cancer treatment at a later stage, probably a stage 3, because we say stage 1 and 2, we say 90, more than 90%. And the modality of treatment, probably it's only a surgery is sufficient or surgery with hormonal therapy. And the economical impact is also less. Suppose we say stage 3 and stage 4, where you require a multimodality of treatment. Patient requires surgery, patient require chemotherapy, patient require radiation also, patient requires hormone therapy. In spite of all these things, stage 3 we call it the prognosis is around 70%. When it comes to stage 4, it's less than 40%. See, so much cases we come across. We hear the story like, sir, one of my uncle is diagnosed of cancer. He had no symptoms at all. Probably we picked up at the when we went, he had a stage 4 liver cancer. So when my one of my aunt had a breast cancer, she had no symptoms. When we went, it was almost advanced stage. In spite of doing all the things, we did whatever doctor said. We went to Mumbai also for radiotherapy, everything, but still we could not uh, cure the disease. See, this is the problem with late diagnosis. See, the amount of effort or amount of the treatment is also on the higher side. The overall the outcome is less. Probably the why this cancer day and the awareness for the screening and to be aware of the symptoms is the reason is this. See, probably whatever as we move on, say whatever the incidence cannot be, there cannot be too much change in the incidence. You cannot bring down the incidence by say around 20-30% lower. See, only thing what you can change is the outcome of a disease. Suppose it can be picked up early, it can be patient can. I mean, now we think 5-10 years down the line, probably the breast cancer patients used to survive for only 5-6 years. Now we see more than 10 years survival, 20 years. People with breast cancer stage 1, stage 2, they survive up to 20 years if detected very early. So how will it affect our lives? This is a very important slide. Usually I like it. So will it turn Vidhan's the upside down or the politicians inside the upside down because of the increasing cancer cases? So much of uh, I mean, the cost involved in the treatment or the affordability issue. See, nothing is going to change. See, cancer just turns your world upside down. It's going to change your perspective on everything. It's your life, your relationships, and the future. See, there's so many examples I can say. We had one a daughter and a mother coming to a clinic. She had just come for some ECG, some health checkup kind of thing. When they just like examined her, there was some X-ray they did. She had a lung cancer. We did a biopsy when it turned out to be a stage 4 lung cancer. So when she was diagnosed, she was totally asymptomatic, probably sometime on and off cough kind of thing. In another 4-5 months of time, daughter's wedding is there. She is like, somehow, doctor, if I can witness my daughter's wedding, that is fine. Rest, I leave it to the God. So we had one policeman also. He is like, he's constructing a house, 3 months. Now in the middle, he had some vomiting complaints with indigestion kind of thing. He had some gastric complaints like on and off. He was diagnosed with a cancer of the stomach. Like in another 6 months' time, he's going to complete his constructing the house, and in a year time, his son's wedding is there, marriage. So he was like, "What do I do now?" And we had one recently one TV reporter also. She had just a small swelling in just in front of the ear, which was there for a long time. She had not probably she had thought it's not that important. So marriage was there in 3 months. She is like, sir, anyway, because the cosmetic things, I want to get it removed. So we did a FNAC, we did imaging, everything. Finally, it turned out to be a cancer. Now the question is like, should I postpone my marriage? So what is the prognosis? What is the survival chances? See, so many things. See, even definitely, even with the World Cancer Day, the theme is like the same. So if not detected early, so it is going to be a very challenge and very difficult to the outcomes also. The only way we can change these numbers is to increase the awareness. See, cancer is a treatable disease, and the chances of survival is high if detected in time. And the timely diagnosis and the timely treatment is very important in cancer. It's not that, okay, we have somebody, patient coming with a lump, so which was there since 2 months. So a biopsy was done, it turned out to be a cancer, imaging wise, everything. So it is stage 1 or stage 2 cancer. And if you reverse it, surgery is the treatment of choice. See, cancer doesn't wait for anybody. So it is the timely diagnosis and timely treatment. Once it is diagnosed, it has to be out of the body. So again, catch it early and stay ahead. So who is at risk? Suppose we call it a risk factor, a characteristic behavior, which increases the likelihood of developing a disease or experiencing a negative outcome. So we call it, so what are the risk factors? What common risk factors we see? So again, it's the lifestyle risk factors. We see tobacco and alcohol. It's almost like more than 50% of the risk factor. It's mainly on the tobacco and the alcohol. See, the use of tobacco again combined with alcohol or alcohol with tobacco, it is going to have an additive effect. And unhealthy diet. Say probably having more of a stored food or a processed food. Nowadays, even with a lot of junk foods also, we don't know what chemicals, see, which is easily available. So it is stomach filling, and probably you want to find a good restaurant where the food is served healthy, probably you may not find it. So you have each and every corner, you have a burger, pizza, all those things. So probably and a timely food. Probably you're not having a timely food also. That is also one of the things, risk factor. And physical inactivity, which is being more common now. So we do, I mean, desk job. You're all the time over the computer or sitting, all those things. So which indirectly again will increase the risk of obesity, and which in turn, in the long run, will have other adverse effects. The chronic exposure to the sun, which is usually more common in the West, not so in India. So, but still, chronic exposure can give rise to skin cancer, what we call it as a melanoma, and air pollution also. Nowadays, we see so much of poor air quality index. In Delhi, we had a recent data from one of the hospitals saying that so much of air pollution. Now, I mean, the kid is exposed to that air pollution from the age of 5 or 6, probably is exposed to that same chemicals and the pollution. So probably he'll develop a cancer at the age of 25 to 30. So usually it is around 20 years is the 10 to 15 years, or 20 years is the time where you have a chronic exposure, the risk of cancer. So that is the reason why we are seeing so much of cancer cases in younger generation also this time, between 30s and 40s. And exposure to the chemicals also, probably the fruits we eat, the vegetables. Now, there was one data from Bangalore Cancer Hospital also. They had identified that the fruits which they use some chemicals to ripen it, so it caused a uterine cancer, which was linked because of the hormones they use. So there was increased risk of uterine cancers in them. Again, the high energy radiations, probably the CT scan kind of thing, and also the chronic infection, probably a urinary tract infection which is there for a longer time, or it may be a reproductive tract infection which is not resolving unless the proper antibiotic or proper treatment is not taken, and infection persists for a longer time. Probably that can lead to a cancer also in a longer run. So what are the things, risk factors, what we cannot change? One is the age. Again, the aging again is a risk factor for cancer, and also the sex. The family history, genetics. We cannot change the genetics. Probably the parents or the grandparents had cancer. Probably if it is inherited in the gene, or it is through the hereditary familial thing, that cannot be changed. So only thing it is, you have to be aware of the thing. So probably the grandfather or your aunt or somebody had a cancer. So what was the age of the cancer, and what was the characteristics of the cancer? Probably if he or she had developed a cancer at the age of 40 or 45, probably if there is a family risk, the whole of the family should be started screening 10 years early. Suppose you are 35, probably you should start your screening at 35. If suppose somebody in family had cancer at 40, probably you should start screening at 30 years of age. That is all. See, tobacco again, it is a very important thing. So intentionally, I put this slide as like tobacco is literally it's going to burn the life. See, the problem with tobacco is it's like Vikram Betar. So once you start, probably it may be fun or something like that. Once it becomes an addiction, you cannot leave tobacco. Or even tomorrow you leave tobacco, tobacco is not going to leave. The problem with tobacco again, suppose somebody has a history of smoking or tobacco usage for 5 years or 10 years. Suppose one fine day decide, okay, New Year resolution, I'm going to stop use of tobacco or stop smoking. It doesn't mean that from tomorrow or another next 5 years I will not have cancer. Suppose I have a history of smoking for 5 years, the next 5 years I'll have a risk of cancer in spite of not using tobacco. Suppose I have a history of 10 years, the next 10 years I'm going to have risk of cancer. If it is 20 years, again, it is up to next 20 years I'm going to have a risk of cancer. And the other thing is the addiction also. So once it's addicted to tobacco, it is very difficult. So we call it as a, how do we measure the addiction? It is like once somebody gets into that addiction phase. So morning, once he gets up, he's so restless till the he ha, ha he'll have this first cigarette in the morning. He'll be so restless. So after that, it is easy to talk to him. That is the time frame from getting up to the first cigarette. If it is a very, it's getting shorter. Probably it was initially 3 hours. Now it has become 2 hours. Now it is the moment you get up, within 10 minutes you have to have your first smoke. That is the addiction. Because these are the two things. Like it is very difficult with tobacco. And the other thing is what nowadays what we are seeing is tobacco causes, like you name a cancer in you name an organ in the body, it will cause cancer of all whatever any organ you mention. The other thing what common we are seeing is the second cancers or dual cancers, double cancers. What we are seeing mainly in the tobacco people. Okay, fine. Somebody had a use of tobacco for 20 years. He had some oral cancer. We had to remove his jawbone, everything. Then he underwent radiation. Okay, he's cured of cancer. The risk does not end there. He can develop a secondary cancer in somewhere in the esophagus or in the throat or something. That is what we are seeing. The risk continues even after the treatment. So suppose we see what all cancers tobacco can cause, right from the oral cavity. So whatever, the tongue, the inner side of the oral cavity, the jawbone, the throat, voice box, pharynx, foot pipe, into the windpipe, you see the lungs. So almost from the mouth up to the esophagus and stomach, this side the windpipe and also the lungs. And it can cause liver cancer also. It can cause pancreatic cancer. It can cause urinary bladder cancer. It can cause kidney cancer. It can cause colon cancer. Again, in females, it can cause uterine cancer and also a breast cancer also. So tobacco along with alcohol, it is going to have an additive effect, like either using tobacco and alcohol or alcohol with tobacco. It is going to double the risk of cancer. See, how do we see it? This is also a data from Globocon saying that 5 out of 10 cancers are attributed to this modifiable habits, which can easily prevent it. Unhealthy food, probably having junk food. Probably, I don't say you don't have in a restaurant or anything. Probably you just limit it, probably once in 15 days or once in a month. Have a food habits. Probably again maintain an ideal weight and some form of physical activity. Probably it's a morning or evening. You have some 1 hour of some physical activity. Avoid smoking. Avoid chronic exposure to the sunlight. We say between 11 and 2. That is where you have a exposure. I mean, to avoid the sun exposure. And vaccination also. And a timely vaccination also will help you. These are just very simple things which can decrease the risk of cancer. So, what are the symptoms? So usually, most commonly, I come across saying that sir, cancer, unless it is advanced stage, we don't have any symptoms. She had no symptoms at all. Only at stage 4, when it became bigger in size, she had some tumor spread to the brain. She had headache and giddiness. That time we realized. See, always you'll have noticed some changes, but it's important to pick up. There may be something new or something unusual or something which hasn't gone away. So there are so many examples. Like we had one 66-year-old male. He was diagnosed with a stage 4 kidney cancer. When he came, he had a cancer kidney which has spread to the from kidney. It has spread to the liver and lung, which was just in 3 or 4 months of time. What was his complaints? The no complaints. So when we were asking him, he told us, no complaints. Only thing was I was feeling a bit tired. So anyway, I'm 66. Obviously, I'll have when I suppose I could take the stairs or something. I do more than a usual work. I feel tired. That is obvious for 66-year-old. So when we looked at his old reports also. Just hemoglobin was on the lower side, somewhere 9.5, less than 10. So when we inquired what was the reason why the hemoglobin is low, he told again, I'm 66. You cannot expect a 14-gram hemoglobin. It will be low only. Again, the daughter, when she was asking, yeah, I also noticed he was initially he was having 4 chapatis before. Now he is having only 2 chapatis. Then he told, no, I had taken out all my, just to, we were waiting for the dentures. So that is the reason why uh, the intake was less and I have lost weight. So always we have reasons or we don't give importance to our own body. I had my, just recently I met one engineering friend also. He was like he had bought a new car. The service was due for first year service. He was like, no, I have to give it on this day. Whatever I can take leave from my office, but the servicing has to be done. So servicing was done, everything. So he got back his car. Then he just noticed that there's some small sound he's hearing. So there's something wrong. Again, he went back to mechanic. Then he told the mechanic, sir, there's nothing. It's just the service is done. No, you'll have here some noise. No, no, no. You please thoroughly check the thing. Then he was like bent upon. No, there is something. Finally, there was some screw was not tightened or it was bit loose. So much like minute details we look into it. Probably we should also see we ourselves are the better people to take care of or observe what are the changes in our body. There's some famous quote from Kalidas also saying that Sharira Madhyam Kalu Dharma Sadhana, which means that, see, the primary dharma is to keep our body healthy. See, that is what, see, unless we notice or we take care of ourselves, probably it is difficult for the doctor or someone else to notice. Or when it comes to that point, probably the disease would have been advanced very much. So, what are the symptoms? So, you should look for. So, if there is any lump anywhere in the body, all of a sudden you notice there is a lump somewhere in the chest or in the abdomen or in the armpit. So, if it is unusual, then it has to be brought to a notice. And bleeding. If you have bleeding when you're passing stools, there's some blood in the stools, or when you're passing urine, there is a blood in the urine, or when you cough, there is a blood tinged, or when your vomitus contains a blood. I'm not saying these are the usual symptoms of cancer. All the symptoms need not be cancer, but this has to be evaluated and you have to rule out that it is not cancer. See, it may be a gastritis kind of thing. It may be just a tumor, not a cancer, but unless diagnosed, we cannot leave these things like that. Probably you have a weight loss. You're not into dieting or gym, but still you have a significant weight loss of more than 10% in 6 months or more than 5% in a month. So that we call it as a significant weight loss or pain, which is not going away. So probably you have some oral ulcers, which is not healed, or the cough, which is persisting and changing voice. See, these are the symptoms which everyone would have experienced. See, probably you have some spicy diet or some gobi manchuri kind of thing. You would have had an oral ulcer. Probably the next 3 days you have a home food or some rice. Automatically by day 5 or 7, the oral ulcer would have gone. So whatever the if something which persists for a longer time, even the cough also. Say everyone might have experienced. We had a cough, very bad cough. We ended up 2 syrup bottles, still the cough is not gone. 2 weeks over. Somewhere third week, you feel that slightly there's a little bit decrease in the cough. Somewhere between third and fourth week, you see the cough is gone. If the cough persists for more than a month, more than 4 weeks, those things needs to be. If the cough, when you cough, there is some blood tinge in the sputum, that has to be brought to a notice, or that has to be evaluated, or there is some change in the voice. The patient had a persistent cough. Now that he suddenly noticed there is some change in the voice. Again, the same, the mouth or a tongue ulcer, bloating in the abdomen. Is there any trouble in swallowing? Suppose the patient say, initially I used to have solid foods. Now suddenly I feel that I cannot have solid foods. there's some problem. Liquids I can take easily. When I have a solid, like I feel there's some catch in my throat. And also the change in the bowel habits, what we call it. So probably we say, as per the definition, we say passing 3 times a day stools is also normal, or passing once in 3 days is also normal. Suppose we have some altered habits kind of thing. You're having diarrhea for a week. After that, you have a constipation for a week, which is being the same, repeating on and off like that. That has to be evaluated. Or the diarrhea, which is not stopping at all. Or every time you have some constipation kind of problem. See, suppose these are also the problems it's normally which everybody would have experienced. You had some pani puri or masala puri, you had some bad stomach, you had loose stools for the 2 or 3 days. Then you had only curd rice for some time. Okay, by a week or 10 days, you are fine. So any problem which persists for a longer time, that requires an attention. So or any change in the breast, suppose suddenly you notice there is some lump or some redness, or you feeling something heavy or unusual, or there is some swelling in the armpit. So those are the things which require attention. And also, which is more common in the West, we call it as a mole or some black mole over the face or body. Suddenly it has changed in its character, what we call it, change in the size, or suddenly it has become itching kind of thing. So those are the things which require attention. So it is never hesitate to consult your doctor. See, you need not come to an oncologist directly. See, first and the foremost, see if there is some problem, you meet your family physician, or you say it may be whoever may be, your family physician, or it may be a general physician, your family doctor. So if once you bring it to the notice of your doctor, suppose he feels no, there is some problem which has to be addressed or evaluated, then only the further testing can be done. Every time you need not come to an oncologist also. Actually. See, because again in cancer, again as I mentioned, see if it is diagnosed early, the chances of cure is more. Early detection, timely diagnosis, and treatment and management. If it is in stage 1 and 2, the treatment is simple, the prognosis is good, and also the cost of the treatment is also less. Suppose it is diagnosed in a later stage, stage 3 and 4. As like I was mentioning, that stage 4 kidney cancer. So finally, it had spread to the almost like liver and lung, everything bones. The only option was to put her on some tablets. There was no other, and our intent of treatment was not to curative, just to control the disease if possible. He was put on a tablet, what we call it as sunitinib, and the tablet costs around 11,000 for one tablet, which he has to take it daily. And her daughter was like, "Sir, whatever it is, like I don't mind. Is there any chance of cure?" No. See, if it was just probably a 6 months or almost close to a year, if he was picked up with a small just swelling or small lump in the kidney, a simple surgery would have been the complete treatment. There was no need for any further treatment. So that is why again early detection, timely diagnosis, and treatment. The prognosis is very good. Suppose it is diagnosed in the stage 1 and see, other important thing, it's a very good initiative from the West. Recently, it has been put up in the oncology also. What is called as a getting it right first time. Because see, in cancer, everything depends on the diagnosis. Accurate diagnosis is the key for the successful management of cancer. See, biopsy is the only way we can say whether it is cancer or not. So the biopsy has to be accurate. So in oncology, what is the practice is whenever the biopsy is done, we double check it before doing a surgery because any of the cancer surgeries are radical surgeries. What we call radical means it is it requires an extensive resection. Probably it may require a multiple organ also. So before subjecting a patient for a radical treatment, either it's a radical surgery or it's a chemotherapy or even radiotherapy. So the diagnosis is very important. Accurate diagnosis. So it's always we double check because of late what we are seeing is we see the patients from the second and third tier cities coming up with just biopsy reports are saying that cancer, and our doctor has told tomorrow only you have to get operated, or else the cancer will spread. And there are instances where they have underwent surgery also, and final report is not cancer. So it is important we accurately assess the biopsy report and doubly confirm that, and what is the correct stage of the cancer. Is it correctly a stage 1 or 2, or it is an advanced stage, and then start the treatment, because whole of this the treatment is just based on this report and the staging. So cancer, I can say, is no longer a death sentence. So initially, like probably 5-10 years back, once we hear cancer, okay, that is the end of life. Oh, chemotherapy, I don't want to subject my mother to chemotherapy. That will cause a lot of side effects, and surgery also she will not tolerate. So cancer means the end of life. So today, with so much advances in the treatment, surgery, chemotherapy, we have targeted therapy, we have hormonal therapy, we have immunotherapy, we have radiation with specific to the target sites, what we call as the cancer site also. There's so much of advances. We see nearly probably in a breast cancer, now we say it's 20 years is the survival for stage 1 and 2. Even with stage 4, what we call it as a metastatic stage 4. Stay patients with even stage 4 breast cancer, stage 4 ovarian cancer, they survive for 3 to 5 years. And it's no longer a death sentence. So it is better to prevent and be aware. See, I say it's a cancer risk in the general population around 6%. See, there should not be fear of cancer also. You should not have a fear. Just that regular health checkup, and you should be aware of your what is your lifestyle habits. Because see, we had one a patient also, 70-year-old. He was diagnosed with myeloma. We call it as a bone cancer. He was a headmaster. He had no habits, no alcohol, no smoking. Daily he used to carry that lunch box from the home, eat, come back. Timely food, lunch break you have, evening 5 o'clock he is back from his work. He is walking, he is doing in the morning and evening. All those things. We were like surprised, like in spite of having a good lifestyle, no habits, and regular, I mean, timely food and physical activity, still he had a cancer. So when we just inquired about his lifestyle with their family members, all those things, the only habit he had was probably he was an old timer. He used to use that firewood for the preparation of the food and I mean, hot water, all this. Only thing is he used to blow that nozzle kind of thing just to ignite this firewood thing. So there is a data saying that long-term hydrocarbon inhalation can cause bone cancer. See, this was probably it's a lifestyle thing which was not taken into consideration or anything. See, because again nowadays what is happening is the cancer is becoming multifactorial. So it's not you may not have a habits or you have a healthy lifestyle. You've been doing good physical activity, everything. Probably the environment. So the environmental factors also it is playing a more role than your own. Probably you don't have a history of cancer in the family. You don't have anything. You've been regularly working out, doing, eating good food, maintaining some physical activity, going to track everything, having a regular health checkups. Still, having a regular health checkups is important in spite of probably all the things. So, just to reduce the risk, don't use tobacco and alcohol or limit the use of alcohol. Stop tobacco if possible. Avoid it completely. Eat healthy food. Maintain an ideal weight, whatever the weight for your height thing. Be physically active. In spite of all these things, suppose I don't have any family history. I don't use tobacco, I don't use alcohol. I'm having a homely food. I'm maintaining ideal weight. Going to gym morning and evening. But still, the regular health checkups for all the people above 40. An annual health checkup is very important. And do not hesitate to consult a doctor. Suppose somebody doctor says this is something thing. Suppose you have a doubt, you have to take a second opinion. It's nothing wrong in taking a second opinion. rather than just leaving it like that. Just a few of the cases what we had done, we just wanted to highlight it. So this was a patient from Chintamani. He was a teacher actually. He had a cancer of the tongue. So initially he went for a Ayurvedic treatment for 3 months. So it was just a small nodule on the left side. In 3 months, it was almost like it has grown by 30-40%. So when he came, it was almost like a close to around half of the tongue was involved. So we removed the half of the tongue, and his tongue was reconstructed with a forearm muscle actually. Forearm from the left hand, we took a forearm wrist muscle, and it was there. Now it's almost like 4 years. He completed surgery. Following surgery, the radiation was given, and he is on regular follow. Even in spite of having a good treatment, regular follow-up is also important. So the chances of disease coming back will be there initial 2 years. Suppose you cross the 2 years, now it's he's 4 years, almost like next by coming December, October, he'll be finishing 5 years. So he's doing good. And he's recently also last year his son has joined MBBS also. This was one 10-year-old boy. See, sometimes the second opinion also timely it is important. He had a bone cancer of one of the leg bone actually. So he was advised will better to remove the whole leg, the right side. So when he came, we have a tumor board where we have a medical oncologist, pediatric oncologist, and the surgeon. So it was little bit advanced disease. So we thought since he was a young boy, so we thought we'll give him chemotherapy, 3 cycles or 4 cycles. We'll see how the tumor respond to it. But then probably we'll take a call. So after 3 or 4 cycles, he responded very well. So this was the bone. I mean the titanium this thing, the knee replacement kind of thing we did. And it's almost like now 1 year. From last year, he started going to the school also. This was one a medical student actually. She was a third year medical student. She was from Nigeria. So she was earlier operated in there only. She had a recurrence of the bone tumor, what we call it as a backbone, scapula bone. So which was completely removed, and we had put this whole raw area was reconstructed with a thigh flap. And she went back again. She's going back to her medical school from January. She started. There's also a patient with tumor in the forearm. It's been 2 years. He's been running around. And finally, he decides, okay, let me operate. So for his good thing, it was not cancer. Still, it was just a benign tumor kind of thing. There's also what we call it as a parotid tumor, we call it. Usually it comes in front of the ear. So it's a very technically challenging surgery. What the white structures, what we see here, this is the facial nerve, we call it. These nerves usually supplies to the eyes, the nose, the angle of the mouth. So any of the expressions, these nerves are important. So any injury to these nerves will have difficulty in swallowing, I mean, closing the eyes, or there's some deviation of the angle of the mouth. So this is one of the challenging surgeries we have. There's also thyroid, a lady who has been very afraid, like somehow with can it be managed without surgery or something. So finally she came after 2-3 years with still increased in size. And for her good, again, it's a benign thing. Still, it's not a cancer kind of. This also is what I was doing, getting it right first time. Uh, there's some small tumor kind of thing which was not completely evaluated or diagnosed. She has underwent a surgery outside. So then the report turned out to be a cancer. So then we had to do a revision surgery, and we did a reconstruction also. Some abdomen, the skin and the fat, which was put back to that raw area. And she's doing well. Thank you. Thank you for the patient hearing, and thanks for the opportunity. Hope it might be helpful. See, probably telling the same things, probably um, to your family or your first circle or your friends. Somewhere you helping out some probably a friend or somebody, to reach out to a doctor. See, that will serve the purpose. Probably. Thank you. Any questions?
Uh, Doctor, we have some questions. Can eating non-veg food also lead to cancer? Can you see
Yeah,
the
yeah.
chat? There are
Chat
some
box.
questions. Yeah.
Yeah, non-veg also. See, it is always like a balanced diet. See, too much of alcohol or too much of non-veg, also what we call it as a red meat. So there is a data saying that it can increase the risk of colon cancer. So is there any health deterioration may occur significantly or symptomatic? How to the attacking cancer is near future. See, any that's what. See, any complaint, any symptom or anything, something new you have experiencing, that has to be brought to the notice. Then what is the cause? Suppose you have a low hemoglobin. Okay, what is the cause of this low hemoglobin? You have a weight loss of more than 10%. Okay, what is the, why am I losing weight? Is it because of the diet or it's some physical activity? Both the things are not there. And what is the reason? So it is important to get evaluated and to have a diagnosis. What is, okay, my hemoglobin, my platelet count is 50,000 only. Okay, I had some dengue fever or something, then following which my platelet count is low. So better to have a diagnosis. And what kind of screening helps to identify all types of cancer? See, there is no, I mean, the one tool for all the cancers. What is the breast cancer screening? What we call it? All females. See, in India, as per the data, see, 85% of the women doesn't have any of the risk factors. I mean, there's breastfeeding or a timely marriage or the timely first child. Probably now off late it is little bit 30, 35, it is going ahead. But the earlier data says there's no smoking also when compared to the West. Only thing is the age and the sex, which is the only risk factor for a woman to have a breast cancer. So it is advisable to do an annual mammography, which is a simple X-ray of the breast, we call it. To do it from the age of 40, annually you have to get a mammography done. And patients with using tobacco or no history of tobacco or tobacco and alcohol, oral screening for any of the head and neck cancers, and also X-ray of the chest from the age of again 40. You can get just a simple X-ray of the chest. So in any of these simple tests, we find out a lesion or a lump or something unusual. That those are the patients to be subjected for the further testing. Again, in the colon cancers, patients with, as mentioned, non-veg or with a lot of red meat or processed meat or stored food. So stored food also, they say the preservative used, say they say few of the preservatives and the chemicals, the nitrosamine compounds we call it, those also increase the risk of gastric cancer and also the colon cancer. So from the age of 50, there is a risk that even the colon also, they can develop some growth kind of thing, what we call it polyps. Suppose we leave the polyp like that, over a period of time, it can change into cancer, say in 8 to 10 years of time. And what is the incidence of cancer? Say it's around 10 to 15% at the age of 50. Probably it is around 25 to 40% by age of 75. So we advise in 5 years once to undergo a colonoscopy kind of thing. A tube kind of put into the motion part or through the mouth also to visualize the gastric mucosa, all those things. If there are any abnormality, a biopsy would be done and it would be subjected, like whether it is just a simple tumor or cancer or any further has to be done. So annual mammography for the female, chest x-ray. Suppose they have a history of smoking and alcohol both with the risk factor, it's better to be vigilant. chest X-ray also, and a colonoscopy for more than 50 years. You can get it once in 5 years. Along with this, probably after 40, you get an annual health checkup done. It may be a simple blood test. How much is the hemoglobin? How much is the white cell count? How much is the platelet? How much is the creatinine? And how much is your sugar? So all these things, and along with that, get an X-ray and ultrasound of the abdomen and pelvis. So any abnormality in this, so then any further testing can be done. Yeah, again, the regular health checkup is just any annual, any hospital you can get a blood count, creatinine, sugar, chest X-ray, ECG, and ultrasound of the abdomen and pelvis. That is the basic checkup. And people now of late they say, "Sir, will I do getting a PET CT scan done? Can I diagnose cancer?" No, you cannot diagnose cancer. So, and those tests are not required also. Just a basic health checkup. And if there is any specific complaint, suppose you have a cough which is not going, or it is troubling you badly, then probably you can get a CT scan of the chest like that. See, again, we spend most time a day sitting on desk. What type of cancer? See, again, it is a obesity related cancers. Again, you can develop colon cancer, you can develop pancreatic cancer. See, it is important that every hour, 10 minutes, you spare time and just walk around. Because nowadays, again, the sitting is a new disease, sitting disease we call it. What lifestyle changes can be made to lower the risk of cancer? Again, a good physical activity and a regular health checkups. Avoid street food or unhealthy food. Probably once in a while is fine. And maintain an ideal weight. That is fine. The role of micronutrients. One of my friend received 3 months in for lymphedema. Probably it may be specific to some of the thing. Probably even after 40, it is good you take some vitamin supplements also. There's nothing wrong in taking the vitamin supplements. See, my mother had lung cancer, which was detected at a large stage. She don't even eat non-veg. Yeah, this is one more common thing, what we say in the Asians, we call it. Females, 40 years, Asians, they have a risk of lung cancer, irrespective of whether they are smokers, non-smokers. That is probably it's a genetic thing, especially around the 40s or 50s. A female who are especially non-smokers having a lung cancer. So it is equally important you annual health checkup from the age of 40. See, chronic fatigue. Again, this is most common probably after the COVID. So probably it is because of the lack of physical activity, probably, or you have some what we call it as a lung fibrosis following the COVID. So you don't have enough lung reserves. Probably you're doing a good breathing exercises and taking a vitamin D supplements also will help you. Like, fatigue is also a symptom of cancer. Probably if you rule out everything, probably you take tablets of vitamin D and you do some good breathing exercise, some good physical activity, all those things. Probably if it doesn't subside, and then probably evaluating it for cancer is good. Or else it is more of a stress or a work related thing. So it's a daughter-in-law. See, any cancers developing early in their life, probably it is 30s, before 30s or before 40s. It is most of the time it is genetic. We have seen patients with 22-year-old with a stage 4 gastric cancer. She had a stage 4 gastric cancer and she had a breast cancer also. She had no habits or nothing related to her lifestyle, everything. This is purely a genetic. Probably it may not have manifested in their parents or grandparents. It is just the passing on the gene. probably at some point of time, the gene would express. So usually the patients who develop cancers very early are usually very difficult to treat and very aggressive cancers. So it is genetic cancers are usually they have a multiple cancers and difficult to treat, and usually they present at a stage 4 only. See, doing a biopsy will not spread the disease. So biopsy is like there are two kinds. What we do as a FNAC, we put a small needle and take out few cells from it. Other thing is we put a bigger needle and take a small piece of tissue from the tumor or whatever the lump. So by doing a biopsy, there is no risk of spread.
Uh, Hi, everyone. So, yes, we had actually a very good session. Sorry to interrupt you, Dr. Karthik.
Yeah.
But yeah, you have answered a lot of our questions. But I
Hmm.
just wanted to, let everyone know that as our doctor is very busy, we had a limited time. We already hit 6. So just
Yeah,
wanted to introduce Akshay here.
yeah.
He's a clinical by background, and he will, like to introduce what we do with Aura Health. We work
Okay.
with oncology department and conduct a lot of tests. Akshay, over to you. Can you just please introduce our, viewers with
Yeah.
all of the things we do?
Firstly, thank you, Dr. Karthik Prasad. It was an
Yeah,
excellent session.
yeah. Thank
Really
you.
good
Hi.
to know.
Yeah.
Hello as well.
Hmm.
I think from my perspective, I just wanted to give a bit of an overview. I am a clinician by background, working in the
Oh,
National Health Service for about 12 years.
okay.
Part of different organizations like Guy's and St. Thomas, Oxley's, Chelsea, Westminster, and everywhere. Works in
Oh,
projects and
nice.
programs across the segments, right from
Yeah.
emergency services to oncology to everyone. Part of two
Okay.
tech companies that I built over there. Exited that about 2 years ago, came back to India. My mother had cancer, about two different types of cancers, actually, one of the rarest case in India, I would say.
Hmm.
However, she was given 6 months to live. She managed to live about 16 years with 10 recurrences and two different types of cancers. So the story was absolutely amazing. She lived a great life. However, it did tell me one thing, that she was never screened. Her mother had
Yeah.
cancer and her mother's mother also had cancer. And even as
Oh,
a clinician by background, I was never
okay.
able to understand why screening is so important. I thought
Hmm.
that why don't we build a company that is Aura
Hmm.
Health today, focusing
Okay.
clearly on the health screening and parameters. So that's
Yeah.
the overall story of Aura. What I
Oh,
also wanted to put out to everybody over here is, as doctor has already suggested, we do a great amount of corporate screening camps, screening programs. We have different tumor marker tests that we use. We use BRCA1, BRCA2 genetic testing wherever is needed. We have a cancer risk assessment that goes out as well. We use eye breast examinations, where we do the breast cancer screening many places throughout as well. We've done more than about 25,000 screenings now, and it's ever growing. As doctor has also rightly said, the cancer is like a more of an epidemic now. It's rising every day. We will cross more than 20 lakh new cases. Overall burden will be remaining up to 1 crore in the country. And we want to change that. We want to improve the health outcomes. So whoever over here is there and listening to me today, try and go back and take back the things, that what do we can do in a cancer screening side of things. If someone is at higher risk, how do we protect them? What can be done in terms of testing? What kind of age bracket are we in? Like HPV vaccinations, we've done about more than 10,000 vaccinations in the last year. It is HPV is something that can be helped to prevent cervical cancer. Coming from a UK background, cervical cancer will be eradicated by 2037, whereas India doesn't have a cervical vaccination program in place. So, that's why we are actually fighting the battle over here. And hopefully that's going to change with Aura Health coming in, and we aim to do that. So yeah, I'm happy to answer any questions if anybody wants to. But I just thought I'll put it out that we are doing some amazing work with IMT, and we're taking it forward in terms of the screening programs. Not only just in cancer, we work in cardiac, we work in fitness. We have different AI technologies that we combine, and we take it forward from there on. Thanks, Anamika. If there's something else, I can happy to answer.
that's very nice, Akshay.
Thanks, Dr.
Probably, and I mean, today it's always the technology and the partners.
Absolutely.
That's how probably you can reach people and
Absolutely.
get it done. Yeah.
Any
Yeah,
questions?
so with IMT Care, you all are on IMT Care, so you can come to us if you want to do some test that is live there. And if you want to do any specific tests for your, family and everyone, you can just reach out to us. We will help you out in every way possible. All of the tests, all of the screenings we can do for you, the AI scan and everything. So yeah, you can reach out to IMT Care, your CAMs and everyone, your HRs, so we can help you out accordingly. If anything else, Akshay, you want to add, you can add it. Otherwise, we can end this session.
I think somebody just asked a question on HPV vaccines, and then it's extremely important for the cervical cancer that we need to put out. It's one thing that we can all do to eradicate this disease, especially many of the young girls get affected. And actually, if it's given between 9 to 14, it's a completely accurate efficacy is around 98% and up. So wherever you go back, please take it back to your corporate world that we all need to be vaccinated. The vaccines can be given up to 45 years, Gardasil 4 and Gardasil 9. We're doing a massive camps across India on this, and a lot of corporates have taken it up as well. So we are really, really proposing this as one of the most important things for the next year or so. This is our main aim, and the breast cancer screening program that we do and everything else. Yeah, so I think there's one question that I would like answer.
That's great. I guess a lot of people must have got their answers. And for any further questions, you can just, contact us, contact Akshay, or get your HR to contact us, right? So we can answer your questions, we can help you out in any way possible. And yes, it was a great session. A lot of people got their answers and it was interactive. So thank you, Dr. Karthik. Thank you, Akshay. Yeah, we'll end this
Thank you.
session now. Have a great weekend, guys. Bye-bye.
Thank you.
Bye.